Hey guys, welcome back to my YouTube channel Knowledge is Power. Today I'm here with you all to discuss all the IEC materials that are needed in your HWC if your HWC got nominated for SSU and Kayakalp. So without wasting much time, let us start with our video. If you are new to this channel, don't forget to click the bell icon below and do share among your CHO friends. First IEC material you need to keep in your HWC is 7 rights of medication. Right patient, right drug, right route, right time, right dose, right reason, and right documentation. Next, IC material regarding the 5 standard precautions: hand hygiene, personal protective equipment, biomedical waste management, instrument processing, environmental cleaning. Next IC material you need is lab protocol for discarded sample. What are the protocols you will follow before discarding any sample that are used in your HWC? Like if there is any liquid waste like urine, body fluid secretion, etc., then you need to use 1 to 2% hypochlorite solution for 30 minutes. Then you need to dispose at a deep burial pit, and after that you need to maintain in the proper register. If there is any infected needle, you need to use hub cutter. Along with that, you can use 0.5% hypochlorite solution for 30 minutes and you have to discard in the sharp pit. If any anatomical waste like human orgasm, blood, soap, cotton are generated in your HWC, you need to use gloves always. Along with that, for disinfecting the items, you need to use 1% hypochlorite solution for 30 minutes and you need to discard the items in the deep burial pit. Next, other reagent and other chemicals you have to dilute with water as per the guidelines. Then the use slide in your HWC, you can disinfect with 1% hypochlorite solution for 30 minutes and you need to discard this item, the slide, in the sharp pit. Next IC material you need, which is very important, is hand washing IC material, which is a simple and effective method for prevention of any nosocomial infection or hospital acquired infection. These are different steps explained in a brief way. Step 1 is palm and fingers. Step 2 is rubbing of the hands. Number 3, finger and knuckles. Step 4, thumbs you need to clean thoroughly. Step 5, fingertips. Step 6, wrist and forearms you need to clean it thoroughly. Golden rules you should remember while hand washing: remove all the jewelry and watch before hand washing. Roll the shirt to above elbow level. Secondly, wet and apply soap on hands and forearm up to elbow level. Thirdly, a normal non-medicated soap is good enough, or you can use hand rub or Savlon solution or Dettol solution. Next, dry hands either in air or by single use sterile towel or sterile paper. Multiple use cloth towels are not recommended. Alcohol based hand rub solutions may be used as an alternative. The 5 ml solution should be sprayed on all parts of the hands. Follow above steps. Rub hands to dry. Next IC material you need to keep in your HWC is 3 bucket mopping system. In HWC it is 2 bucket mopping system. In the one bucket you need to use water and you have to add detergent. Then in the second bucket you need to use the plain water. 3 bucket system is used whenever the area is very contaminated. In the third bucket you need to keep water, then you need to add 0.5% bleaching solution of phenyl. The purpose of using 3 bucket mopping system is to include the use of 3 separate sinks for each of the 3 tasks, namely washing, rinsing and sanitizing, in a unidirection method. Coming for the next IC material is the pollution free chart. How you need to prevent the air, water, noise pollution. A mandatory chart you need to keep in the entry gate of your HWC. Coming for the next IC material, which is very important, before doing any activities in your HWC, you need to follow this PDCA policy, that is planning, doing, checking or studying and acting. Here is a simple and effective approach for solving problems and managing change. The model is useful for doing any kind of activities in HWC. It measures on a small scale before updating or doing any procedures and working practice. It will help to increase the quality of the work. Therefore, before doing any work, the HWC staffs they need to plan, they need to do and check and act repeatedly. Coming for the next IC material, in case of fire emergency, you need to have this IC material and you need to follow step by step. First, rescue, followed by the alarm, then contain, then extinguish. Next IC material is the infection control program. Number one, you can control any kind of infection, so proper hand hygiene. Then using PPE kit. Then instrument processing, sterilization or disinfection method. Then environmental control by cleaning and mopping. Then fifthly, biomedical waste management by using the different buckets, biomedical waste buckets. Next IC material, you need to keep HWC for patient safety and to prevent medication error. Look alike, sound alike medication you need to keep separately. Then you need to follow FEFO if the drug has got expired. Next important IC material you need to have in your HWC is needle stick incident flowchart. Already regarding the needle stick injury, I have made another video, so you can go in the description link and can watch the video in full details. Then you need to keep this smoking free area IC material in your HWC. Then important IC material you should have is standard operating procedure for liquid waste management. Then next IC material you should have is Swachh Bharat Abhiyan Ek Kadam Swachhata Ke Aur. You need to keep this banner in your HWC. Then you need to have herbal garden in your HWC. Different medicinal plants, different flowering plants you should keep in your HWC. These are some symbols you need to keep, that there is no provision of spitting in near the HWC area. Then if your HWC is a delivery point HWC, then you need to have this IC materials. First, regarding the 6 cleans during delivery, 6C, you need to follow clean hands, clean surface, clean cord tie, clean towel, clean blade, clean cloth to wrap the mother. 7 rights of medication you need to follow: right patient, right drug, right route, right time, right dose, right reason, and right documentation. Next, IC material on the harmful activities at labor room. Firstly, no routine enema. Secondly, no routine saving. Thirdly, no routine induction augmentation of labor. Fourthly, no place for routine suctioning of the baby. Fifthly, no pulling of the baby. Sixth, no routine episiotomy. 7. No fundal pressure. 8. No immediate cord cutting. Number 9. No immediate bathing of the newborn. Number 10. No routine resuscitation on warmer. Then regarding the breastfeeding, you need to keep in your HWC. You all need to explain all the breastfeeding techniques, proper positioning of the baby and the mother during breastfeeding, importance of exclusive breastfeeding. Then you need to have this IC material regarding the high risk pregnancy. There are different conditions that may lead to high risk pregnancy. You all, being the CHOs and the NM even, they need to know the different conditions that may lead to high risk pregnancy. Some of the causes are grand multipara more than 4 gravidas above the age of 35 years and below the age of 19 years. If the height is less than 145 centimeter, multipara with bad obstetrical history or previous repeated abortion, non-engaged head near term at 38 weeks, abnormal presentation and multiple pregnancies, conceive after treatment of infertility. Medical factors like cardiovascular disease, severe anemia, diabetes mellitus, obesity, pulmonary tuberculosis, thyroid disorder, psychiatric disorder, jaundice during pregnancy, previous history of CS section, preterm labor, antepartum hemorrhage, very big, very small baby, all IUD more than 2 weeks, polyhydramnios, oligohydramnios, all are some risk factors for the pregnant. Also, if the pregnant woman is having gestational hypertension, preeclampsia, eclampsia, etc. Next IC material you should have if your HWC is a delivery point. You need to know about the active management of third stage of labor and you need to manage this case during emergency. Another IC material you should have is the management of atonic postpartum hemorrhage cases. Next IC material you should have regarding the vaginal bleeding before 20 weeks, or you can say the prevention of vaginal bleeding or the antepartum hemorrhage. Then antenatal examination chart you need to have in your HWC. The different fundamental grips you need to know. In this chart also you will have different ANC checkup timings. You can explain through this IC material to the common people about the importance of doing regular antenatal checkup, antenatal visits to the nearest subcenter, PHCs and CHCs, so that the high risk cases can be treated earlierly without any further delay. Thank you guys for watching this video regarding all the IC materials. I have tried my best to explain all the IC materials in a very brief way. This is the part 2 of the video and part 1 I will put in the description link. So for more such videos related to CHO related topics, medical topics and nursing topics, you can comment down in the comment section below and do subscribe my YouTube channel.